Hi.
Hi.
Hi, my name is Kristen.
Hi,
I'm a
Kristen.
student nurse. I'm going to be taking your health assessment today. How are you doing?
I'm doing great.
Good?
Great. Thanks.
It's nice to meet you.
Nice to meet you as well.
Alright. Can you confirm your name and date of birth?
Kristen Perry, 2/18/89,
Okay. And how tall are you?
5'4".
And do you mind telling me what you weigh?
Yeah, 225.
Alright. And is Kristen okay to address you by, or do you go by something different?
Yes, Kristen is fine.
Okay. So what brought you in here today?
I am having a little issue with eczema on my hands, dryness from using excessive hand sanitizer.
Okay. Any other health concerns that you have?
None.
None? Okay. All right. So let's see. What communicable diseases have you had? Like chickenpox? Have you had the flu?
No.
No. You never had chickenpox?
I had chickenpox as a child.
Okay. And are you up to date on all your immunizations?
Yes.
Yep. And even a flu vaccine?
Yes.
All right. What medication allergies do you have?
None.
None. Any current medications that you're taking?
No.
And do you smoke?
No.
Any caffeine?
Yes.
Yeah. And what types of caffeine?
Coffee and tea. About 2 cups a day.
All right, perfect. Any alcohol use?
Yes.
And how much would you say, and how often?
I'm like a social drinker, so about twice a month.
What types of alcohol?
Wine.
I like wine. Any recreational drug use?
No.
All right. Any food allergies?
I'm lactose intolerant.
And what kind of symptoms do you have?
Like stomach pain.
Okay. Any histories of surgeries?
No.
No. Anytime you've been hospitalized overnight?
No.
Have you been in any accidents
Yes.
recently?
Yes. A car accident on November 20th, 2018.
And any injuries from this accident?
Whiplash.
Was that diagnosed?
Yes.
Whiplash?
Yes.
All right. A little bit of your family history here. Any history of heart disease?
No.
High blood pressure?
Yes. My mother.
Your mother, okay. Stroke?
No.
Diabetes?
Yes. Mother.
Respiratory illness?
No.
Or cancer?
No.
Anything else in your history?
No.
No. Okay. Let's see. Any history of breathing problems?
No.
No asthma?
No.
Last TB test?
It was in 2018.
And what were the results?
The results were negative.
Have you had a chest x-ray before?
Yeah, on the 20th after the car accident.
Okay, but it was not
It
TB.
wasn't related to TB.
Any history of lung disease, such as asthma, pneumonia, or lung surgery?
No.
Okay, on to your heart. How often do you exercise?
Rarely.
Would you say you tolerate exercise well?
Yes. If I actually did it, yeah.
Sometimes just not enough time in the day.
Right?
Any chest pain or heart palpitations?
No.
Dizziness?
No.
History of high blood pressure, leg pain, or cramping when you're walking?
No.
History of heart disease, heart attack, heart surgery?
No.
Okay. So this next portion is a little bit about food and what you consume and what you understand as far as your nutritional status. So if you're looking at a 24-hour period, what's your normal breakfast like?
Like 2 eggs, bacon, and coffee for breakfast.
Lunch?
A hamburger without the bun and add the veggies.
Okay. And for dinner?
Like chicken and vegetables.
So low carb,
Low carb, yes.
that keto diet.
Yes.
And for snacks?
Like cheese and meat.
All right. And who prepares your food?
Myself.
Any recent weight gains or losses?
Yes.
Is that
Weight gains
Oh, you gained. Okay.
over the last year.
And are you satisfied with your weight?
No.
Any appetite changes?
Yes. Less cravings for sweet foods.
Excessive thirst?
No.
And what would you say your daily intake would be for water?
Water? Oh, about 9 cups a day.
Okay. Now, are you familiar with USDA MyPlate?
Yes.
Okay, so here is a typical MyPlate according to the USDA with your fruits, your grains, dairy, veggies, protein. If you could just in this section maybe draw what you think that your plate looks like.
Okay. Yeah, typically a lot of veggies and moderate protein.
Okay. Fruits?
Very little.
Very low. Okay. So I think that's pretty accurate. You maybe increase your fruits just a little bit more, but it looks pretty balanced. Any dental problems?
No.
Your last dental exam?
About 2 years ago, so I could have some problems.
What's your daily hygiene routine?
I brush 2 times a day, no
Okay.
flossing.
Any history of gallbladder disease or diabetes?
No.
Do you have any difficulty eating, swallowing, chewing? Do you have heartburn, pain?
No.
Any problems or recent changes in your bowel elimination?
No, it's been pretty normal. Normal in color, normal in size.
Any abdominal pain?
No.
Your last bowel movement?
This morning.
And how often are you going?
Like once a day.
You don't notice any abnormal color, like is it dark or bright red?
No.
Any diarrhea or constipation?
No.
Any problems or recent changes in your urination?
Just urinating more because I'm drinking more water.
That's good. Any burning, pain, or hesitancy?
No.
Alright. Any history of a urinary tract infection?
Yes, I've had a couple.
And when was that last one?
Like 2 years ago.
Any difficulty in holding?
No.
Any blood that you're noticing? Is it cloudy, dark?
No.
Do you feel like you're able to go completely?
Yes.
All right, away from the uncomfortable stuff. All right, have you been experiencing any hair loss?
No.
Dry scalp. Do you have dandruff or any lesions
No.
that you've noticed? Any dry or brittle nails?
No.
And other than on your hands, have you been experiencing any dryness, itching, sores?
No.
What skin products do you usually use?
Lotion and oils.
I know you said you use a lot of hand sanitizer.
Yes.
Are you using sunscreen?
No.
And are you currently experiencing any pain?
No.
All right. And what are your sleep habits?
I sleep a good 7 to 9 hours daily.
Oof. And are you taking naps?
If I can. I would prefer.
Naps are nice. Any difficulty in falling asleep?
No.
Staying asleep?
No.
And do you take any sleep aids?
No.
Good for you. Do you have any limitations in your mobility? Does it hurt to walk?
No.
Any history of arthritis, backache, swelling, muscle weakness?
No.
And do you wear your glasses all the time?
Yes.
And they're necessary for driving and daily
Yes.
function? When was your last eye exam?
This month.
This month.
Yes.
And since then, have you noticed any vision changes?
Well, this is a stronger prescription.
Any history of cataracts or glaucoma?
No.
And when was your last hearing exam?
Hearing exam. That was like 2 months ago.
Any hearing aids or hearing loss?
No.
Ear infections or ringing in your ears?
No.
Any changes in your taste or smell?
No.
Any tingling or numbness?
No.
Dizziness, blackouts,
No.
seizures, memory changes?
No.
Okay. And when was the first date of your last menstrual period?
January 8th, 2018.
18 or 19?
19.
Okay. And have you experienced menopause?
No.
Do you have any difficulties with your menstruation?
Cramping.
Is it debilitating or
No.
manageable?
Yes, manageable.
And when was your last PAP?
In 2018,
And what were your results?
the results were negative.
Normal? You didn't
Normal?
find no.
No.
Okay. Any children?
No.
And do you do self breast exams?
Yes. Probably daily.
Daily. And have you found any breast lumps, tenderness? Do you have any discharge?
No.
Any vaginal discharge or sores that you notice?
No.
And what do you use for contraception?
Condoms.
Do you have a history of any sexually transmitted diseases or HIV?
No.
And are you having any difficulties with sexual activities?
No.
All right, and these next questions are a little bit more about your psychological well-being, so if they're uncomfortable, just let me know. But anything you say stays here. Do you have anybody that you consider your support system?
Yes, my boyfriend.
And who do you live with?
By myself.
Okay. Are you satisfied with your living arrangements?
Yes.
And what's your home environment like? Is it single-story house? Do you have stairs that you use every day?
It's an apartment on the 3rd level.
That's a lot of stairs.
Yes.
Any pets?
No.
Do you feel safe at home?
Yes.
And if you had to rate your health on a scale of 1 to 10, what would you give yourself?
A 5.
And what's your most important health goal?
To obtain a healthy weight for me, which is around 150 pounds, and incorporate a healthy eating lifestyle.
Well, it sounds like you've already started that with the keto, trying to make some changes.
Trying.
What other things do you do to be healthy?
Right now, that's about it.
Okay. What's the highest level of education that you've completed?
A bachelor's.
And what do you do right now?
Hemodialysis technician.
So that must require a lot of physical activity, walking around.
Yeah.
Are you satisfied with your career?
Yes, but I am wanting more room for growth.
Any major life changes in the past year?
Yes, I'm starting nursing school.
Well, that's a big thing. Any current stress or fears, concerns?
School.
The school?
Mm-hmm.
And what do you do to help cope with that stress?
Usually read devotionals, pray.
Do you have a history of depression or mood swings, anxiety? No. And where do you find your source of hope and strength?
From God.
And what religious practice do you?
Christianity.
Christianity.
Mm-hmm.
And what's your greatest personal strength?
I would say balancing life.
And do you feel like you have control over your future?
Yes.
What health beliefs do you think will impact your health care at this time?
I don't think any health beliefs will.
Do you take any herbal medications or alternative therapies?
No.
So if I was to say I'll be right back with some pain medication, how long do you think you'll wait before calling a nurse's station?
Probably 5 minutes.
Do you make all your healthcare decisions?
Yes.
And over what areas of your healthcare do you feel like you have the most control?
All.
What foods do you like to eat when you're not feeling so good?
Soups and orange juice.
Do you like to have anybody close by when you're feeling ill?
No, just the TV.
Help pass the time.
Yes.
And how do you prefer to receive any health-related teachings or information?
Through demonstration.
Is there anything else that you'd like to add that we haven't talked about?
No.
No. And what ethnic culture do you consider yourself?
African American.
Almost done. And is English is your primary language?
Yes.
Kristen. I think I am all set. It seems that you're fairly healthy and you're making changes to your lifestyle that should have a positive reflection for your health. You're up to date on your immunizations. No real medical history to be concerned with. Okay, and if you have nothing else to add, then I will get this information to the doctor and we can get you seen.
Okay, thank
All right?
you.
Thank you for your patience.
Thanks, Kristen.
Have a nice day.
You too.